Hi, this is Deb Birdsall, and I'm here to talk about the core principles of infection prevention and control. I'm an infection preventionist, and I'm working with Hectone Institute of Medicine. So, what are the core principles of infection prevention and control? The core principles of infection prevention or control are to try to prevent hospitalizations, deaths, and illnesses with persons by balancing the risk of infection with least restrictive environment and person-centered care within long-term and congregate care settings. The basic principles of infection prevention and control, the core prevention practices have not changed. General vaccine administration, source control, and the use of personal protective equipment, detection, isolation, and screening for organisms and illnesses before they can spread to others. We do that through surveillance, hand hygiene, including use of alcohol-based hand rub and washing hands with soap and water. Critical reasons, critical ways that we prevent infection. Surface cleaning and disinfection, and ventilation, air filtration, and water management. All of these places are where germs can hide that cause illness, and so we need to be aware of where they are so that we can prevent the illnesses. So we start with these prevention basics. Hand hygiene, the use of standard precautions. If it comes off of another person and it's wet, you want to put a layer of protection between yourself, your clothes, your eyes, your mucous membranes. Vaccinations, getting people vaccinated is a critical component of infection prevention. Cleanliness of surfaces, air, and water. A lot more emphasis on the cleanliness of the air around us. Prompt identification and isolation of ill individuals so organisms can't get spread. Clear communication and documentation between people in the same care community. That includes the residents, the families, and the staff, and also interfacility communication between congregate care settings, transport personnel, and acute care settings, and antimicrobial stewardship. If we don't give unnecessary antibiotics, we don't develop as many drug-resistant organisms. So how do infections spread? First, you have to have a germ and a place for it to live. And then a susceptible host, specifically someone who doesn't have immunity to the germ or their immune system is being overwhelmed. A way for that germ to enter the host, such as direct contact, which is touching contaminated surfaces or items, indirect contact through the air, through contaminated food, water, feces, water droplets, and particles in the air. And what makes a person more infectious? Well, if they're coughing, if they've got a cold, if they have other respiratory symptoms where they're sneezing, coughing, even when they speak, the organisms can get out into the air. If they're sick with a fever or right before they get sick, sometimes they're more infectious. The closer the contact for the longer period of time, the more likely a person can spread their germs. Uncovered wounds, where you have drainage, active diarrhea. So we're going to talk first about surveillance. So surveillance requires that you look at what's really going on. This is why long-term care facilities really need a full-time infection preventionist, because it takes time and it takes training to understand what to look for and have time to look for it. Also, the support of public health is critical. Surveillance, you use as many current tools in long-term care as you can to help gather information. 24-hour reports, verbal reports, going around and looking at what's happening with wound care, injection safety, using your electronic health records, your secure emails, making sure that you've got clear communication with pharmacy and labs, CDC and tracking maps. You have FluView and COVID-19 trackers, and NHSN or other public health sources that can help you look to see what is your residents are at risk from. So what do you do with that information? You determine your risk and then you share it. There are excellent resources out there that can show you what to do within data once you collect it. CDC in Illinois, Telegen QI Connect. Telegen is our Quinn QIO. APIC, Associations for Professionals in Infection Control and Epidemiology. Also, a lot of really good state resources. Illinois has excellent long-term care facility guidance. Minnesota has excellent antimicrobial stewardship programs with monitoring and tracking data that can help you and information that can help you analyze that. So we want to make sure that our staff stay healthy. Protecting the staff actually protects the residents with vaccines. There's good data that shows that the more you can get your staff vaccinated for preventable diseases, the less likely they are to bring it into your residents. Making sure that your residents and your stay away from staff that are ill, and that means avoiding presenteeism, which means people working when they're sick. So you want to make sure that employees don't stay at work when they're sick. You want to make sure that you screen them, and you want to make sure that you're not forcing people under your supervision to participate in group activities or to come to work if they're not feeling well. Hand hygiene, critical. Unfortunately, in healthcare, the overall average hand hygiene is less than 40% of the time. People are cleaning their hands fewer than 40% of the time when they should. We want to make sure that we have good tools out there, good training, good competencies, so that people understand that alcohol-based hand rubs are the preferred method of hand hygiene if hands are clean or you haven't been exposed to someone who has infectious diarrhea. There are some excellent tools from CDC with Project First Line. The links are here on the slides. It's really important that you look at this good information that CDC has. 5 moments for hand hygiene. This is from the World Health Organization, but it gives, contact before patients are contact, before you're doing aseptic techniques, after you've come in contact potentially with blood and body fluids, after patient contact, and after contact with the resident or patient surroundings. Source control and PPE, standard and transmission-based precautions. We learned in 2005 that inappropriate reuse of gloves and gowns caused outbreaks of multi-drug resistant organisms. Your staff has to be competencied and trained and monitored when it comes to how they're using personal protective equipment. You also have to make sure that your personal protective equipment actually is personal protective equipment. This is an example using red food dye, and you can see that this is a gown that does not protect against strike through. Whereas in this case, this situation, it's the same type of material. It's alcohol-based gel with red food dye. There was no strike through. You want to make sure that you have an interdisciplinary team that is looking at your personal protective equipment to make sure that you have appropriate equipment, source control and PPE. Surface cleaning and disinfecting. There's environmental services and the related areas. So you're talking about maintenance, you're talking about the plant operations, kitchen and laundry. All of these have to do with the environment, and we want to make sure they all stay clean. Environmental cleaning and disinfecting is critical. Having your staff have the appropriate tools, the appropriate cleaning and disinfecting agents at the point of care when they need them. And also, it has to be very clear to your staff that keeping the environment clean is everyone's job. It's not just one particular department's job. You want to make sure that your disinfectants are selected by an interdisciplinary team of personnel. This is new it's part of a performance improvement project, but it's new generally for congregate care settings. You want something to be non-toxic and non-irritating, have a low toxicity, not damage surfaces, easy to use, have an acceptable odor, be economical, and a one-step cleaner disinfectant is much easier to use. CDC, once again, Project First Line, how to read a disinfectant label. The link is here. It gives you all of the different tools, what the active ingredients are, what the EPA registration number is, the contact time, how long does the surface have to stay wet with the disinfectant to kill the germs, what the precautions are, what the first aid is, storage and disposal, and where it should be used. Reading the entire label is critical. Preventing the spread of germs in food. Food safety. The government has great information, basically hairnets, hand hygiene, keeping hot foods hot, cold foods cold, not touching ready to eat food with bare hands, handling utensils properly, keeping things clean, neat, and covered. And if there are any questions, you throw it out. Healthcare laundry, developing and following practices on handling, storing, processing, and transporting laundry to prevent the spread of infection. You have to make sure that you have, this is part of your infection preventionist job, monitoring to make sure that laundry practices are implemented and any deviations must be identified and corrected if actions put in place. This is your infection preventionist working with housekeeping, working with EVS, working with laundry to ensure that you have safe practices. Air filtration, ventilation, and water management, things that we did not think about in long-term care, and especially that they would be that the infection preventionist would play a part in monitoring these types of things, because respiratory illnesses have not and will not go away. Not only do we have to worry about COVID, but influenza, RSV, there are also other organisms, rhinovirus, human metapneumovirus, a lot of respiratory viruses that can cause major outbreaks in long-term care that look the same. Unless you actually do a viral panel or appropriate testing, you may not even know what's causing an outbreak in your facility. So it's critical that what we focused on earlier or before is to isolate people and to put PPE on people. What we need to look at more now is physically removing the hazards through filtration, through air sanitation, through water filtration, so that we end up having a safer environment to begin with. The CDC and OSHA have excellent respiratory protection guidance, including having fit test programs. Yes, you still have to have fit test programs. That is not going to go away. So getting to know this, and the more that we can keep the air clean, the surfaces clean, the less likely that someone is going to pick up something, a healthcare associated infection within our communities. CDC has done a lot recently in 2023 talking about how to improve ventilation in buildings. And there's an emphasis on portable air cleaners. And you want to make sure that if you are getting portable air cleaners, that they are verified by the Association of Home Appliance Manufacturers, and you want to make sure that you have something, it's a clean air delivery rate enough for tobacco smoke so that you can filter particles, small particles out of the air. You want to make sure that people understand that source control and personal protective equipment work. This is another excellent infographic from CDC and Project First Line. All of these are tools that are free and are available to you to help you develop your infection prevention and control plans. Water management plans are critical. It isn't just testing for Legionella once a year. It's really making sure that your plant management is working with an expert in water. It's in the same way they need to be working with an expert with your ventilation to make sure that you prevent the spread of waterborne pathogens, because it isn't just Legionella. It can be mycobacteria, something called Elizabeth Kingia, Acinetobacter. Some of the extensively drug-resistant and multi-drug resistant organisms can hide in drains. Funguses and virus, waterborne outbreaks have occurred in healthcare settings. There are new reported reservoirs, including drains, electronic faucets, decorative water fountains, and heater cooler devices, which we generally don't use in long-term care, but any sort of place where it's moist and water can stagnate is a concern. So, in conclusion, we want to make sure that we are following the high C's of infection prevention and control, which is clean hands and gloves, clean clothes, clean equipment and environment, containing drainage, covering wounds, carefully assessing what's going on in your building, current vaccinations for everyone, careful use of antimicrobials, collaborating, not just within your building, but interfacility collaboration, and communicating. It's critical. Public health and the infection preventionist roles are vital links to the implementation of core measures of infection prevention. There are tons of other resources out there. Welcome to infection prevention and control. It is a separate discipline. We really need you. Your residents need you. Your coworkers need you. The community needs you to prevent infections and hospitalizations and deaths. Thank you very much.